did a literature review to look at kind of what the impact of smoke-free policies have been, and one of the most interesting things that came up is, first, we haven't really dealt with smokers or the issue of smoking. Essentially, smoke-free policy, all it's done is push smokers off the property, right? So we haven't helped them to stop smoking. All we've done is kind of pat ourselves on the back and said, look, it's not happening on our property. But instead, when you drive into most hospitals, pretty much anywhere in the country, what you see, you know, under the big hospital signs on the public sidewalks is tons of people out there smoking in the freezing cold in the winter and everything. They're smoking. Some people are vaping, right? So we haven't actually addressed the issue, the health impact of smoking. All we've done is just pushed it off the property and then felt somehow good that we've done something about it.
Out of sight, out of mind.
Right, exactly. I'm a public health consultant.
Okay. And you're working with the BC CDC?
Yes, I'm working with BC CDC, which is under the auspices of the Provincial Health Services Authority. And so we're devising smoke-free policy for the Provincial Health Services Authority.
Is it really policy, or is it just a process of, you know, out of sight, out of mind?
No, it's a policy. We're actually trying to look at new and more progressive ways to reduce tobacco smoking on health authority property while supporting smokers to either temporarily quit while they're in a hospital or in a care facility, and ultimately, of course, to permanently quit. So, you know, our goal is to achieve 100% smoke-free properties, recognizing, though, that we have to support the people who are smoking because it is disadvantaged and marginalized populations who are the smokers now.
What do you think, then, of Canada's vaping policy and public health, more importantly, public health policies in Canada towards vaping?
So I think the sad thing is we haven't actually taken into account the latest evidence on vaping. If you look at most public health websites, so if you go to quitnow.ca or HealthLink BC, which is kind of the government-regulated websites here in this province, they say, right, Health Canada doesn't have any, it hasn't regulated vapor products. There's no short-term and long-term evidence about vapor products. But we know that's not true. In fact, there have been a substantial number of systematic reviews showing immediate short-term health impacts, positive health impacts on people who completely switch, so completely quit combustible tobacco cigarettes and use only vapor products. They're like multi-system organs that have improved health outcomes. So it's a bit funny, with many other, you know, public health initiatives, if there was something so evident like this that had such a huge impact on health, usually we switch right away. But with this one, we have tendency to have a moralistic, like, we just assume tobacco and vapor products are the same and cut them out.
But why is that? Yeah, why is that?
I don't understand, and I'm wondering, I mean, this is kind of a worldwide phenomenon, except for the UK, which is taking a completely different approach and is not pro-vaping, but supportive of it as a smoking cessation tool. But maybe it's because our friends across the border in America have taken for a long time around tobacco an abstinence approach.
But this really is this is government public health, and the non-profit public health groups.
Yes.
Who've got gobs of money.
Yes.
Right? They are all against it.
Yes. Yes.
And begrudgingly, do they find a manner in which that they're going to maybe legalize it, which they are in Canada here, but for instance, though, not only will they legalize it, but they are going to tell every Canadian that they are not allowed to tell anybody, communicate in any manner whatsoever, that vaping, well, never mind whether or not it's better for you than smoking, you aren't even allowed to compare it to smoking.
No, it's ridiculous, and I actually don't understand it, and we've been having a big discussion about how do we deal with that? How do we make progressive public health policy in this atmosphere that's clouded in misinformation around vaping?
But isn't the problem progressive? Isn't the problem partly in that word?
Yeah, I think you're probably right? And the fact that we're ignoring these disadvantaged populations. Like, we're not listening to the consumer, we're not listening to the smokers and what they need. We're not meeting them on their level, right?
Does public health have actually any experience like that with any other issue in the past where they treat patients as consumers and listen to them and take feedback?
I think there's lots of examples where we've been better when it comes to opioid use the last few years with Insight here in Vancouver. Like we've taken a more, that we're willing to come down and understand what you need to support your
bicycle helmets, you know, that's a public health issue. They're not listening to consumers. You have to wear your bike helmet, right?
Yeah.
When was it that this issue became of your mind to work on, and when was it after that did you realize a switch went off and went, no, this vaping thing, there's something a little hinky going on here with regard to it's being demonized?
Yeah, really only in the last year as I started to dig into it, and I did a literature review on like what was going on around smoke-free policy, and I did the research around what the health impacts are. Then I started to realize, you know, I mean, before I had assumed, like most consumers, like most Canadians, that vaping was equally as harmful as tobacco. I didn't know, and how should we know as consumers, right? If all our public health information tells us that it's equally harmful. But now I try and tell all my friends, vape. It doesn't matter what you vape. Like cannabis, we have cannabis being regulated. So I tell my friends, vape it. It's so much safer, right? It doesn't have to be zero safe, right? We don't have to take a zero tolerance approach. But if it's safer, absolutely, you could save a few years off your life.
So this event, what are you hoping to get out of it?
I'm hoping more people will go out and talk about what the real evidence says, right? So we can have a real discussion instead of the kind of misinformation that's going out in public right now, that vapor products are not safe. We need more people to know that you have an opportunity and an alternative to help you stop smoking.